Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Class 1A drug, which is quinidine. Okay. Quinidine is actually a cinchona alkaloid. This quinidine is a cinchona alkaloid. It is a short-acting drug. It has anticholinergic properties and it also has alpha blocking activity. This quinidine is actually a basic drug. It is a basic drug and it is bound to alpha 1 alpha 1 glycoprotein. This quinidine will undergo glucuronidation and this quinidine is actually eliminated by the kidneys. So because quinidine is eliminated by the kidneys, it undergoes glucuronidation. It is a glycoprotein. It will bind to the alpha 1 glycoprotein. Then it is a basic drug. Now, the uses of the quinidine. Quinidine is actually used in treating arrhythmias, especially atrial and ventricular arrhythmias can be treated with the help of the quinidine. Then side effects of quinidine. The side effects of quinidine are the most common side effect of quinidine is actually GI upset. In the GI upset, it is actually diarrhea is the most common side effect of quinidine. Then, quinidine can also cause thrombocytopenia, and thus it can potentiate, because it causes thrombocytopenia, it can potentiate the warfarin. Quinidine can also cause tachycardia. Also, it can cause hypotension, thus resulting in alpha blockade. Okay, then quinidine can also cause synchronism, especially at high doses. So because this synchronism mainly contains, there will be visual toxicity in the synchronism or ototoxicity is seen, and psychosis are seen in synchronism. Then, if you give high dose of quinine, this high dose of quinine can cause, high dose of quinidine. High dose of quinidine can result in precipitation of ventricular tachycardias is seen. Then, drug interactions due to quinidine. The drug interactions are quinidine mainly. If you use quinidine with digoxin, okay, then if you use quinidine with digoxin, this quinidine will reduce the renal clearance of digoxin. Because it reduces the renal clearance of digoxin is not excreted properly, so as a result the digoxin concentration in the blood increases. So this will increase the digoxin concentration in the blood, will increase, thus resulting in the toxicity. Then quinidine is actually an enzyme inhibitor. Because it is an enzyme inhibitor, it also inhibits the metabolism of warfarin also. Because it inhibits the metabolism of warfarin levels are increased in the blood. Warfarin levels, because they are increased in the blood, this will result in increased bleeding can occur. Because of increased warfarin levels, bleeding is seen. Then these quinidine also have negative inotropic effect. Because of its negative inotropic effect, this is actually avoided in congestive heart failure. It is avoided in congestive heart failure. These drugs also accelerate the AV nodal conduction. Because they will accelerate the AV nodal conduction, this will also reduce the extent of atrioventricular block which can be seen.
thank you and thank you for watching.